Trauma, heat stroke, blood loss, and other injuries can result in hemorrhagic shock, which means that a casualty's internal organs are not receiving enough blood or oxygen. Shock can be life-threatening and needs treatment to prevent organ damage or death. Do not wait for shock to occur. The same measures used to treat shock can be applied to help prevent shock from occurring. The most important step in shock prevention and treatment is to control hemorrhage or blood loss. Control life-threatening extremity hemorrhage with a tourniquet. Control non-extremity life-threatening hemorrhage with hemostatic agents and pressure dressings. If the casualty is conscious, place them in the shock position, on their back with their feet elevated slightly above the level of their heart. This will improve the circulation of blood to vital organs. Place a blanket or other covering under the casualty to protect them from the temperature or dampness of the ground. Take measures to keep the casualty from overheating or chilling. If feasible and appropriate, loosen any tight clothing, including boots. Tight clothing can interfere with blood circulation. Reassure the casualty and keep them calm. Small sips of water are permitted if the casualty is conscious. Evacuate the casualty as soon as possible if medical help is not available. There are a few exceptions to placing a casualty in the shock position. An unconscious casualty should be placed in the recovery position. If the casualty vomits, quickly and carefully clear their airway. A casualty with a suspected spinal fracture or serious head wound should be placed on their back without elevating the feet. Immobilize their head, neck, and back if possible. A casualty with an open abdominal wound should be positioned on their back with their knees flexed to reduce stress to the abdomen and reduce pain. A casualty with an open chest wound should be seated upright with their back against the wall or other form of support, or placed in the recovery position with their injured side to the ground. Keeping the uninjured side up decreases pressure on that side of the chest and allows the uninjured lung to function more easily. A casualty with a minor head wound should be sitting up with their back supported or in the recovery position with their wounded side up. Cautionary note: if a casualty has suffered a lower limb fracture, do not elevate their feet until the fracture has been splinted.